As we know, plasma p-tau217 is a pretty relevant biomarker for Alzheimer's disease. It has been shown in many studies in the research settings that is pretty effective in detecting disease. Or even longitudinally, but not so many studies have been carried in the memory clinic and in the clinical setting, and that's why we came in with our study. So we are followed this cohort of memory clinic of 123 subjects, and they had all done a beta amyloid scan in the brain, and we could be able to check if the plasma biomarkers, plasma p-tau217 and others, alone and in combination, if they would predict for amyloid beta PET positivity in the visual reads setting, or also the associations with as a continuous variable. The main findings are that the plasma p-tau217 was highly associated with amyloid beta centiloids, that is the scale that we use in quantification in the imaging, and it was really highly associated with the plasma p-tau217 with Rs that went above 0.70, so really high. Compared to GFAP and others alone. And then when we looked at the predictability of the positivity according to visual reads, we have actually used the ROC curves and compared them, and we had some really high positive predictive values for plasma p-tau217, especially when combined with other plasma biomarkers. There we achieved a positive predictive value of 97 with all plasma biomarkers combined with the Lasso regression model analysis that dropped p-tau231 and plasma beta A-beta 40, for example, among all the ones that we have looked at. And so maybe it would be worth noticing which one are the one we have analyzed. So there was plasma beta p-tau217, 231, 181, plasma A-beta A42, 40, the ratio, and plasma NFL. These were all of them, and some ratios. So, and were all combined, some were dropped by Lasso, and anyway, the major finding was that in the whole cohort there was a really high positive predictive value with only 2 false positives. But then when we looked at only the MCI before PET cohort, we found actually even a higher positive predictive value of 98, and then really high are in the curve for the whole group all together with some dropping. And this was different from the plasma p-tau217 alone, so there is an added value of actually combining them. Yeah, this is more or less. I do believe that plasma p-tau217 is an extremely good biomarker, but I wouldn't use it alone because at least in our cohort it didn't reach really high positive predictive value per se, and so there is some margin of error, and if a clinician wants to be really sure, or it would be nice to have the panel, and at the moment there are commercial panels that analyze many markers all together, so if they are affordable enough in the future, in the coming future, it's possible to combine together and use this combined approach. Like this is what we advocate. So we are now integrating also neuropsychological data to this data set in order to have also some insight on the cognition and the relation with that. So that will be a full picture of what will be the manuscript that we are going in preparation now.